It is my pleasure to introduce my friend and colleague, Susan Maxsween. She will be your host for the next 30 minutes. She's the Director of Healthcare and Practice Transformation at RMS with over 15 years experience in healthcare operations, NCQA accreditation, quality management, HIPAA compliance training, and of course, PCMH transformation. Her credentials are stellar. As you will hear, she is a cheerleader and a champion of this work. Thank you so much for being part of this journey. We hope that you enjoy this friendly and helpful half hour. Susan, thank you so much for offering to share your knowledge and your passion with us today.
Well, thank you, Sandy, and it's a pleasure to be here. This is the first of many webinar sessions that RMS Healthcare will actually be providing to our healthcare members. It's no surprise that the evolution of the healthcare delivery has been significantly impacted by the cost and the delivery of healthcare, and ultimately the cost to receive care. Patients now, more than before, are and will be expected to invest more proactively and become engaged in their healthcare. What we're looking for and is improving in the overall health of the patients, better engaging them in their own healthcare, taking better care to stay healthy, and asking questions and being prudent. Physician practices, both primary care and specialty care, are busy providing patient care, but also strategically positioning themselves to optimize practice operations while focusing on patient-centered care delivery. And this also extends beyond the primary care, specialty care practice, and we'll touch on that as we go through today's presentation. Improved patient care and coordination of care has captured the attention of the healthcare delivery system nationwide. With the inception of the concept of patient-centered medical home, or as we'll refer to it today as PCMH, much attention has been directed to the overall impact and improved quality of patient care throughout the integrated approach to care delivery. Since the release of the Crossing the Quality Chasm, a new healthcare system for the 21st century, released in 2001 from the Institute of Medicine, significant attention has been directed towards improving quality and coordination of care. It is the notion that PCMH model is essential to improving quality of patient care, but that this comprehensive approach is really improving the coordination and the integration of care that requires the cooperation of subspecialists, physicians, and other healthcare professionals, according to the patient-centered medical home neighbor. It is truly the interface of the patient-centered medical home with specialty and subspecialty practices. And no question, the overall journey of transformation is founded in providing safe, effective, efficient, patient-centered care. And as we go through today, I'm going to give you an overview of really how healthcare delivery has changed and truly the impact of developing that patient-centered medical home. The goal of today's session is to really provide you with an introduction and an overview of the patient-centered medical home and really facilitating that quality-driven patient-centered care. And really the whole notion to this is we have physician practices working together is to build the road to a really well integrated and enlightened healthcare delivery system. And this doesn't happen overnight. This takes a tremendous amount of time, and it takes a tremendous amount of collaboration within the healthcare environment of teams working together. And we'll touch on and identify who those teams are as we go through today's session. But this is, again, to provide you an overview. So really, where has this come from? How is the healthcare delivery landscape actually changing? We understand that the environment that we're working in is changing. I work with many physician practices, and I know intimately working with practices how demanding your environment is. The demands of the patients, the demands of the providers, the insurance companies, all of the different payers, as well as the providers of care. And we know that it's constantly changing. Meaningful use, as an example, has a significant impact on the delivery of care within healthcare delivery in the primary care environment. Patient expectations are changing. Many of our younger patients, even middle-aged, older patients, are much more actively involved and engaged. They're asking questions. They want to be actively involved. They want to understand. The advent of the portals within the physician practice has really expanded this whole notion of having patients really drive care, to ask questions and be involved in from a technological standpoint of being more in control of their health care. And then also the rate of change in the healthcare delivery is growing at an exponential rate. Even with the advent of patient-centered medical home, the work that we see with ancillary care providers, and the expectations from a payer standpoint, from a performance management perspective, we're seeing that's constantly changing. And ultimately, quality care and performance improvement has become an expected level of care. You heard me just a moment ago talk about meaningful use or talk about PCMH. We understand the importance of overall performance and improved patient health status. And those are some really significant things that are driving the practices. And I'm sure for each and every one of you on the call today, these are significant pressure points for you within the practice. These really resonate with you, and you understand how this healthcare delivery system is actually changing. As we look at the patient-centered medical home, the concept, as I said in the introduction, isn't new. It's been around since the mid-1960s, and the American Academy of Family Physicians and the American Academy of Pediatrics are really the owners and the originators of the whole concept of the patient-centered medical home. But as we look at today, we're going to start to dive into a bit on the 7 joint principles of the patient-centered medical home. And it's really key for those of you that have been in the healthcare delivery environment for a number of years. You may remember the term HMO, or Health Maintenance Organizations. Patient-centered medical homes, to a certain degree, work from the same perspective, and that is that the primary care provider is the center of all care in conjunction with the patient. There's really an establishment of an ongoing relationship with a personal physician. That open communication between the patient and the provider, the regular visits, engagement in the care is what's really key. And the physician-directed medical practices. And really what that's speaking to is that the physicians within the practice are driving the care that's delivered within the practice in working with the collective teams in the practice. The third component here is the whole person orientation. Very often we've heard historically that physician practices or primary care may work in caring for the patient from a physical standpoint. But the whole person orientation really ties in both the mental health component and the physical health component in really overall management of that patient. And within the patient-centered medical home, as we've evolved from standards, from the 2008 standards to the 2011 standards, and our newest 2014 standards that were released in March of this year, we're seeing a much stronger integration of the behavioral health component, which is really critically important in defining and managing that whole person orientation of care. The next point here is the coordination of care across the health system. It's really key and important that as we start to manage the patient within the primary care environment, that we're looking to make sure that we're managing it across the system. We know in a primary care environment that we're referring patients out to specialists and even subspecialists. We're tying in the need for ancillary care providers, home health care agencies, dialysis centers, and hospitals and outpatient facilities to really manage their care overall. So it's really important that we, as that primary care environment, look to find the best way to really coordinate that care, making sure that we're getting all of the information out to those providers and getting all of the information back in, so that when we have the patient come in for follow-up visits and looking at how we're managing care, we've got all of the documentation we need in front of us. Enhanced commitment to quality and safety. So as I talked about in the previous slide, we looked at performance management being an important component to that. And that's really when we look at that commitment to quality, is what are we doing to really improve the overall health of the patient? It's perhaps is not necessarily the frequency of the visit of the patient getting in, but where are we seeing the improvements in the healthcare? Are we looking at the lab values? Are we assessing those key indicators in managing care across the board? And also safety from this standpoint. Are they safe within the environment of different continuums within age, but also in managing them on medications, making sure that we're really drilling into potential contraindications of meds and looking at them overall from a safety standpoint. Enhanced access to care is a really key component of the patient-centered medical home. It's not just having the patient or availability for patients to be seen during the normal business hours, but how are we also managing that after business hours? Are we making sure that we have physicians that are available on call to speak to the patients if need be? Do we have referrals to urgent care centers that are affiliated with the practices perhaps, or having as an extension of care and providing services to patients? And also the portal plays a significant role in this. So if you are a practice or an organization that's looking to implement a portal, has started the implementation of the portal and is really trying to make it grow, this really is a key piece in really providing that enhanced access to care. And the other significant piece to this, and unfortunately not as much in New York State as we'd like to see, but reimbursement is really recognized as a value added for our practice, and that's really where we look at ROI, or a return on investment. And within New York State, private insurance companies are a tad bit slow on the upswing of really reimbursing or providing increased reimbursement for practices. Where we're seeing significant impact here, though, is on the Medicaid side. So Medicaid is reimbursing practices that are PCMH recognized, and they even have encouraged practices to go and to continue the recognition process and making sure that they're going in under the 2011 standards, and from that standpoint, incentivizing practices with a higher level of reimbursement because they have gone on to the 2011 standards. So it's really a key piece for practices going forward, and we know that we're on the cusp of seeing continued change. There is legislation that's forth in Congress now as far as looking at Medicare increasing reimbursement for patient-centered medical home as well. So there are a number of different components, 7, that really touch on the joint principles of the patient-centered medical home at a hierarchical perspective, but also at the ground level within the practice. And it impacts the practices in many different ways, but the most important thing that we start to look at is really what are those practice level changes that are going to go on. And it's for a practice that started the journey, that's continuing the journey, and is struggling to really build and have the practice become really cohesive. It starts with changing the culture within the practice. And ideally, it's the collective role and the responsibility of everyone involved, ensuring that we have communication, collaboration, and a true integrated approach in providing that quality care. It's not just the physicians or the practice managers that are managing the process, it's the entire team. And you'll start to hear concepts and themes like team huddles, and team huddles that really integrate the entire practice, be it the front staff that are responsible for registering patients or checking patients out, be it the physicians that are intimately involved as well, the nurses, all of the staff within the practice really have to become actively involved. And this is something that requires a practice to take incremental steps to get everyone involved. And there's a number of different ways that we do that when we look at really building the journey of transformation. And again, as I've said before, we're looking at building a foundation of safe and effective patient-centered and quality-driven care. And at the core of that, you'll see, is the organization culture. We're looking at how we change behaviors within the practice. How do we provide ownership to the team within the practice? How do we get the staff involved? And part of getting the staff involved is having them be actively engaged with the transformation process. Understanding that every staff person within the practice has a responsibility and has ownership to moving us and taking the journey to becoming that patient-centered medical home. And really looking at that it's an organizational approach and not just one person's responsibility. So as we look at the front staff coming on board and being actively involved, part of that process is making sure that they are ensuring the access to care and how they're answering the telephone, how they're triaging calls, how they're closing out the calls that are coming into the practice. How are they managing the patients? We often look at our patients as customers, and they are consumers of care. And one of the things that keeps a patient coming back to the practice is the environment and the tone within that practice environment and how they feel when they're within that practice. Do they feel welcomed from the time that they come into the practice? Part of that is how we're building that culture within the practice of making those patients or those customers feel welcomed. And from that standpoint, not only are our patients our customers, but we as members of the team within the practice are customers. So it's important that, again, as we build and we start this journey, that we build on changing that culture so that we are all a value-added component to really moving the practice to the next stage. looking at how do we have all the staff involved in the process. So looking to take feedback from staff, have them understand what their role is, and have them really engage not only as the team, but also with the patients, and making the patients feel important within the practice and the staff equally feeling important within the practice. As I've worked with practices over the years, one of the things as we start this PCMH journey, or as we're going through the second round of the PCMH journey, or even the third round of the PCMH journey, is how do we actually get the staff involved in getting them on a level of understanding that they understand what their responsibility is. And we also talk about incentives for the staff. How do we get them involved? Part of that is building that culture and having it be emphasized that they are an integral part of that culture. And that we look at how we're moving in the progression on a day-to-day basis. We're going to go in, we're going to try changing processes a bit, and then moving the practice, the patients and the staff through the process. What are our aha moments, and how do we implement those to become part of the culture, and having everyone be effectively involved in part of that engagement within the practice. And it seems simple, but it is an ongoing process within the practice. So let's drill down just a little bit further here. What do we look at as far as the initial recommended steps in adopting the PCMH model in my practice? And again, every practice is a tad bit different, but these are 7 core components of how we're actually going to go through and look at adopting, changing the culture within the practice. Part of that right out of the gate and changing the culture is educating the staff. What is your role in this? And we are a team going through this transition, on this transformation journey. As I say to a practice in the beginning, when we start the transformation journey, is that we will have an amplified focus on the work and staff engagement in the process. So that's really how we start to change our process. Increasing patient awareness and engagement. So as we start to look at building this patient-centered medical home, we're increasing the patient awareness of what we're doing with them. Practices, many practices now have websites, and they use the website as a strong vehicle to really communicate their mission as a patient-centered medical home with the practice. They may promote that through the website, but also through information that they're sharing within the practice. And having patients become more engaged is going to help the momentum with that progression within the practice, improving the quality of care. As we start to have conversations with our patients within the practice to say, we're concerned about you, we care about you, you are important to us as a patient within the practice. We want to work with you to really improve the quality of care that we're providing within the practice. Part of that is not only sharing or making that statement and making it known to the patient, but how do we get our patients actively engaged within the practice? Part of that is how do we learn to maximize the use of our team and having them work with the patient. There's new concepts that are out there, and perhaps not so new, but concepts such as motivational interviewing. So how do we sit down and work with a patient that is struggling with multiple comorbidities or one comorbidity, a new diagnosis, and helping them to set goals that are easily attainable for them. Part of that, and that's really part of delivering that quality of care. So as we work with and we find ways to really maximize our relationship with the patient and helping them drive their level of health to a new level of healthier outcome is part of how we're building that quality of care. Enhancing patient access to information. Both within the PCMH model and within helping patients change behavior is providing access to information. We know we have patients in different levels of continuum within the practice. And what I mean by that is we have individuals that are very savvy on the computer, and they're going to come in and say, well, I saw on such and such website all of this information about my diagnosis. So we have one end where they're overzealous in attaining information that may or may not be 100%. We have individuals that are reaching out to sites on the internet to help them change behaviors. But what else can we do within the practice? And part of it is providing them with the information. Because as much as we have those that are overzealous of hopping on the internet, we have others that are intimidated by the internet and may not reach out to find the information. So how can we as a practice provide information to that patient? What are some of the important educational resources that we can provide to them that really start to ask the questions of what is important to you as far as setting goals, and then how do we help them attain those goals? How do we help them manage on a day-to-day basis? And that's part of improving that quality of care. It's another component of providing that quality of care, as I talked about earlier on, is making sure that we're working with the entire healthcare delivery system, that we're getting discharge summary reports from the hospitals, that we're getting specialist notes back from the specialty care provider practice, and making sure that we've got all of the information needed at the time of the visit so that we can effectively manage that patient and understand what actually the needs are. So that's part of enhancing that access to information. And then implementing the performance monitoring. And again, this ties very closely into the quality of care. So when we look at as a practice, what do we want to focus on in improving within our practice? Is it a specific measure, like a hemoglobin A1C, that we want to see patients have a lower hemoglobin A1C, which is going to be evident in improved quality of care and improved patient commitment? Do we want to look at blood pressure monitoring? Do we want to look at mammography compliance, colonoscopy compliance? Do we want to look at specific factors regarding immunizations and preventive health, as well as chronic disease management? Setting goals for what we want is a key thing for moving the practice in the right direction, and having those be attainable so that we can really start to see and benefit from those improvements. Measuring patient experience is a huge component to this within the patient-centered medical home. And the reason for that is that, as I said a few slides back, we look at our patients as our customers. We want to make sure that we are getting the information back from them, and we're getting honest information back from them. We're able to understand how are they relating with the physician. Are they getting information from the physician in language that they can understand, that the physician is engaged with them, that they're not having to wait too long, that it's not taking too long to schedule an appointment. All of these are really key important pieces for us to really assess how we're engaging with our patients, but also to make sure that we're retaining those patients. Again, as I said, they are actually customers of care. And again, most importantly, in order to achieve 1 through 6, we need to engage the entire team in the work that we're doing. And that's a real key piece to the overall process. So the next thing let's look at is, we looked at 7 key factors here. What are some of the keys to success? And again, recognizing that all staff serve an integral role in the transformation journey. If I've said it once, I've said it a number of times, that our staff really play a key integral role in changing the culture, changing the environment, and really having the transformation be successful. Many times in working with a practice, their goal is to achieve the PCMH recognition. It may take us 2 months, it may take us 6 months, it may take us 1.5 years. But the important point to this is that it can take time, and the important piece, most important message here is that not only do we look at achieving the recognition, but how then do we maintain this day after our recognition is in place. The most important thing for a practice is to be able to say, we have such an engaged team that once the recognition has been achieved, that we've continued the work that we've worked so hard to get to. And our staff is still looking at reports. We're still looking at performance measures. We're still really concerned about patient access. And we're maximizing the use of our portals and a number of different things that we'll drill on as we offer future webinar sessions. Every team member should share in the beliefs, the values, and the goals of the practice. Again, in order to move the practice to be that patient-centered medical home, it's a collaborative effort. So we look at both our non-clinical staff and our clinical staff. And I'll take, with this bullet in specific, I'll look at our clinical staff. Let's say we have a practice that has 3 or 4 physicians and a couple of mid-levels within the practice. We have a wonderful EMR system that we're able to tie into a number of different resources. The most important way for us to be able to really have the shared visions and the shared goals and values within the practice is to make sure that everybody is utilizing and maximizing the resources that we have within the EMR. So if we have templates, everyone is using the templates. Everyone is referencing the evidence-based guidelines. And this is a journey for the practice. As clinicians, they've been trained to help patients improve quality of care. And now it's a standardization within the practice that we want to see all the clinicians work in a unified process. Again, understanding that so as we look at what the clinical staff role is, or not the non-clinical staff role is, again, understanding the next piece to that is that at the core is that patients are the core and our central focus. So how we manage care, how we deliver care, how we assess performance is really looking at the central focus of our patients. So we have to really understand what are those needs of our patients. By listening, by talking to our patients, by having them engaged with us, we better understand what are some of their pressure points. What are some of the perhaps concerns of the patients that we need to focus on within the practice? Do we have an issue where patients trying to get to the office is of challenge to them? What are some of the resources that we can provide or connect our patients to better manage the patient care? And then ultimately is the belief and the mission in providing that quality-driven care within the practice is the integration of the entire healthcare delivery system. So you as a practice is one small ship among many within the sea of managing that patient care, or within the community of managing that patient care. And the important piece there really is, in essence, to change the culture. It's within the practice, but it's also outside of the practice, and it's integrating the entire healthcare delivery system. It takes a community to really drive and to facilitate the change. And this healthcare community includes our hospitals, primary care providers, our specialty care providers, our home care agencies, our dialysis centers, other ancillary care providers such as physical therapy as an example, and also our insurance company, and having everyone working together, working to make sure that the valuable information we're getting from the providers and the insurers are helping us manage our patient care in a timely and an efficient and effective manner, and that we're all working collaboratively and collectively. And this picture really says it all, and that is the entire team in managing the overall health care of the practice. Again, looking at care management, chronic care delivery, disease management, preventive health services, et cetera, and really understanding too that accountable care organizations and healthcare reform is really constantly making this culture within the practice and outside of the practice just continue to evolve. The next thing that we look at is how do we, within the practice, another key important piece here is increasing the patient awareness and engagement. And really, let's look at for a moment what are the essential elements to have more proactive patient engagement. The first thing for us as a practice, we need to recognize that patient participation in shared decision-making results in increased knowledge, adherence, and improved outcomes. The important piece here, though, is that we have to look at each patient individually. We are all individuals, and patients are individuals from the standpoint that if you have a cookie cutter approach in providing a disease management program for a given diagnosis such as diabetes, that may not work with all of the patients. We have to have those patients be more actively involved to see that improved outcome. So a few slides ago, one of the things that I talked about with you was actually better understanding how to get the patients involved. And part of getting those patients involved is understanding what is actually important to them and getting them actually more involved in the care. And the important part of getting them involved in that care is asking them to set those goals. Understanding what is going to motivate them is going to be much more beneficial for you than you setting a goal and saying, I want you to lose 20 pounds within the next 2 months, versus the patient saying, I think it's realistic that I could do this. And having a patient set a realistic goal, whatever it might be, and seeing them achieve that goal is going to really start to build that momentum and that engagement on the patient. They feel as though they've really taken on a responsibility and are managing that. And it also, we have to understand the essential elements that enable that patient involvement, that they have to respect the physician. So when we looked at a few slides back talking about the patient experience, understanding what are some of the pressure points between the relationship of the patient to the provider and how they're involved in the decision-making process. How do we also improve patient knowledge? I talked about providing patients with educational resources that can speak to what their concerns are or how to better manage a condition or how they can actually establish goals. So let's, for an example, here look at a patient that has elevated blood pressure and you're saying to the patient, I want you to manage your blood pressure. That is a pretty direct statement, but let's provide the patients with the resources in order to be able to do that so that they have an increased ownership and increased knowledge. By providing them with a log that they can track that blood pressure on a daily basis is going to help them better understand on a day-to-day basis where they are. It can also provide for ongoing communication between the practice and the patient as far as managing a condition. The next bullet here is physician engagement to encourage patients. So empathy, compassion, respect for the patient are really three important components here. We want to make sure that the providers are engaged with the patient in understanding what their needs are and really focusing what are our barriers. So let's say the physician is saying to a patient, I want you to limit your carbohydrate intake. And the physician says, do you understand? And if he opens the door for patient communication, a patient is able to say to the provider, explain to me what a carbohydrate is. Going back to some of the rudimentary basics can really help in enhancing that relationship between the two so that there is a level of trust and communication between the two. And then awareness of choices. So the provider may say, I want a patient to do X, and the patient may say, can we compromise and can I try doing this? Again, having it really being an essential building block of the two working collaboratively. And again, that patient awareness, that patient engagement are some of the key things to do. Now, as I've said this, I also understand, and I know from working with many, many practices over the last few years, and that this is an ideal situation. And part of the process is how do we get our patients more actively involved? And there are those core patients that we're going to be able to move on that continuum to get them involved. And then there are others that we're not going to be able to do this. This is not something that's going to be done overnight, but it can be achievable little bit by little bit by little bit by increasing the awareness, increasing the engagement, and the overall participation among the practice. And again, the most important thing is that we focus on the time to be actively engaged in the process. Okay? The next piece that we go on to is actually improving the quality of care. And this slide really looks at how do we improve that quality of care, looking at patient values, clinical data, research evidence, in order to really provide that optimal decision. We want to make sure that within the practice environment and looking at improving quality care, that we have evidence of evidence-based guidelines in place, that we're using standardized tools. And we talked about that a little bit further through the presentation, but these are key important pieces. And having standardized tools allows us to look more direct at performance improvements and how to report those performance improvements. Again, educating and empowering our staff, educating and empowering our patients, letting staff know that there are improvements in the quality of care that's given is key motivator to, again, improving the quality of care. And again, it goes back to focusing on the overall culture within the practice. The next piece that we touched on before, and we'll drill down a little bit further now, is enhancing that patient access to information. What are the first important piece here is understanding what the enhanced patient access really is. What does that mean? And what are their questions of how we can effectively manage that communication with the patient? Again, getting patients involved in their care, really implementing a portal, maximizing the use of the portal. No question, portal engagement is a challenge among practices, and getting patients involved is really a key piece to really improving that communication back and forth, and identifying and understanding those barriers to care within the practice. So again, patient access, patient information is really key to managing those patients within the practice. The other piece that we touched on briefly was performance management. We want to look at performance management is really essential, and it's about measuring, monitoring, and enhancing the performance of staff as contributing to the overall practice management. For practices that have gone through PCMH, that have gone through meaningful use attestation at the first level and now the second level, understand how we're looking at performance indicator and performance measures. So again, having those measures and seeing the improvement are really what's key to the practice. Establishing our goals and how we're going to get there is what the key piece is, so that we define what those specific measures, those specific components of care that we're actually focusing on are also important. Enhancing the patient experience. I thought this actually summed it up quite well. It is the sum of all interactions shaped by an organization's culture that influence a patient's perception across the continuum of care. And this came from the Burroughs Institute. And this is really key within the practice because it talks about the culture, it talks about the continuum of care, and it talks about the patient's influence. And this really pulls everything that we touched on together into one component today. And we really want to focus on how we can improve that patient experience within the practice. And that, again, is access to care, our communication, and our coordination of care within the practice level. And these are just some key pieces of how we actually look to engage that patient experience within the practice. That feedback is important. And we've had practices that can go with a tool that they've developed within the practice on their own to share with patients and get feedback. They can go as far as using a CG-CAPS PCMH survey, or CG-CAPS or a PCMH CAPS survey tool in which they're able to report, and that's managed by a certified CAPS vendor, and getting the feedback for patients and at the practice level. And we're able to compare from a quarter to quarter at a practice level. So it's really important that as a practice you look to identify opportunities to really enhance that patient experience and getting that patient feedback within the patient practice. So again, we looked at a number of different pieces here. We looked at building the organizational culture today. We looked at how we improve communication within the practice, how we engage our staff, both our clinical and our non-clinical staff, how we engage our patients within the care. How do we develop a practice that allows us to start that transformation journey? And it's a lot of information that we covered in a very short period of time. And for practices that are new to this, or those that have been on board, or you're a specialty care practice or an ancillary care provider, you all have an integral role in really building and enhancing on that patient-centered medical home. We all have an integral role in really developing and moving care to the next level of being that quality-centered patient care within the practice. Questions and any questions in regards to today's presentation? We do have, there are a couple of questions that did come in today, and I do appreciate those. One of which is, how long does it actually take a practice to become PCMH recognized? Well, that's a great question to ask, and one of the things in asking such a question like this is that depending upon how quickly the practice wants to move. We've had some practices we've taken through in a 2-month period of time, which I don't necessarily recommend, but they can be done. And we've had other practices that can go through in a little over a 9 months period of time. And it really depends upon the stage of readiness of the practice and building their transformation team and moving forward. But the key piece is that the practice sets the time period of how they want to go through and then sticks to that time frame overall. And again, one of the other questions that we had come in was how to get patients involved in the portal. And this is an ongoing challenge for a number of different practices. And really part of the message there in getting the practice moving is continually reinforcing the benefits to the patients and utilizing the portal. But again, with that being said, one of the things that you really need to look at the practice level is what are your patient demographics? Do you have a relatively young population that may be much more apt to hop on the computer and log onto the portal, request an appointment, request medication refills? Do you have an older population, more of a geriatric-centered population, in which you may have more of a difficulty there? So again, there may be some things that you need to look at in moving forward within the practice. So before we come to a close, this is the first of many sessions that we're going to be providing over the coming year through RMS Healthcare. And just to give you a little bit about RMS Healthcare, Sandy opened the presentation and giving you an overview about RMS Healthcare and my background. RMS Healthcare is a division of research and marketing strategies, and focusing, and really what our goal is to focus on optimizing relations with our healthcare clients. We work with our clients hand in hand as they go on the transformation journey, and really we are an extension of the practice and helping them guide through the journey. So we've taken over 100 practices through the PCMH recognition journey under a multiple number of different recognition standards under the 2008 standards. We've also taken them through under the 2011 standards, and probably the most challenging for practices is taking a practice from a paper practice to an electronic medical record practice and going through the recognition journey. So we have a wealth of experience in working with practices, helping practices build that organizational culture so that they can transform the journey. In close, we'll be emailing the presentation out to you tomorrow so that you'll have this to access to share with your staff. If you, after you leave today's session, you have any comments or questions regarding today's session, or perhaps what you'd like to see as another topic for us to present, we'd be more than happy to entertain any feedback from you. Thank you very much for a wonderful presentation, and we look forward to engaging you again. Thank you.